Whenever there is a virus outbreak, contact tracing is essential to curb the spread of the disease. Contact tracing identifies individuals who may have been exposed to people confirmed to have the virus. These individuals are monitored closely and may be quarantined so that they can be treated early if they develop the disease and not expose others to it. This is how Singapore, from its health institutions to government agencies, carries out contact tracing for COVID-19 cases. When a patient is diagnosed with COVID-19, the hospital will interview him to map out a full history of his movements over the last 14 days prior to the onset of his symptoms and until he is diagnosed and isolated. This time frame is chosen to adequately cover the incubation period of the virus, which typically lasts 5 to 7 days. This activity map is a detailed timetable documenting where the patient has been, what he has done, and who he has made contact with. For a patient who came from another country, or what is known as an imported case, this activity mapping starts from the time he boarded the flight to Singapore. The hospital then submits this activity map to the Ministry of Health, which oversees the entire contact tracing operation. The Ministry of Health's contact tracing team comprises staff with expertise in communicable diseases and epidemiology, as well as volunteers from the ministry's various departments and statutory boards. The team aims to completely chart a patient's activity map within 24 hours of his COVID-19 diagnosis. Contact tracers make calls to verify the patient's activity map with third parties, such as family and friends, airlines, and transport companies. During these calls, they also obtain more details and may contact the patient or his next of kin to fill in any gaps in information. The team identifies a list of the patient's close contacts who would be at risk of infection. Close contacts are people who have prolonged physical contact with the patient or live in the same place. They are typically family members, close colleagues, or travel companions. They also include those who have spent at least 30 minutes within 2 meters of the infected person. The ministry will contact these close contacts and check if they are feeling unwell. Close contacts who have coronavirus symptoms are treated as suspect cases. The suspect cases are hospitalized in isolation wards and tested for the virus. Close contacts who are well but deemed at risk of infection will be served a notice of quarantine by a health ministry officer, together with a Straits security officer. They are given the choice of staying at home or going to a government quarantine facility for 14 days from their last contact with the patient. Government quarantine facilities across the island, at places such as the SAF Changi Chalet, Outward Bound Singapore, and university hostels, can house around 2,000 people. More than 200 Straits security officers are deployed daily to these facilities. Their tasks include settling people into the quarantine facilities, patrolling the area, and facilitating check-in and check-out procedures. Contacts under home quarantine must stay in a room and use a toilet that is not shared with anyone else. If a close contact can't be reached or his identity is not known, the Ministry of Health will tap on the Singapore Police Force for help in tracing the person. Daily conferences allow both sides to exchange updates and collaborate. Overseen by a command center, the police's contact tracers are split into 3 teams: an analysis team, an interview team, and a field team. The analysis team gathers all the data surrounding COVID-19 cases in Singapore and identifies possible links between cases. Analytic tools such as word clouds pick out common keywords from the activity logs of different patients. Possible links are flagged as hypotheses to the interview team, which then conducts thorough interviews with patients and close contacts. Information gathered will prove or disprove any hypothesis. Meanwhile, the field team combs the streets to track down uncontactable or unidentified close contacts. The team trawls through closed-circuit television footage and conducts ground inquiries for clues. Such cooperation between the Health Ministry and police has led to important discoveries. Among them is the unearthing of a link between the cluster at Grace Assembly of God Church and another cluster at the Life Church and Missions. Police analysts cross-referenced attendee lists and, through a Singapore-made serological test, detected past infections in recovered patients. This uncovered a chain of infections linking the 2 church clusters to a Chinese New Year gathering in Mei Huan Drive. Extensive groundwork has also paid off in identifying and locating close contacts of patients. In one instance, police had to track down an unidentified passenger of K64, a 50-year-old taxi driver. They knew only 3 things: the type of taxi, the passenger's attire, a white top and black pants, and the passenger's general drop-off location, somewhere along Chai Chee Road. Officers had to visit at least 5 housing blocks in the area and sieve through more than 3 hours of CCTV footage from over 40 cameras. After identifying the passenger's block and floor, they knocked on many doors before finally pinpointing the passenger in his home. A newly developed smartphone app, dubbed Trace Together, also allows local authorities to speed up the contact tracing process. Developed by the Government Technology Agency, or GovTech, and the Ministry of Health, the app uses wireless Bluetooth technology to detect other users in close proximity. Logs of such encounters are stored locally on each user's phone and can be submitted to official contact tracers when necessary. This is useful when infected patients do not know everyone whom they have crossed paths with, and allows for easier identification of potential cases. Meanwhile, the Singapore Civil Defence Force, or SCDF, responds to COVID-19 suspect cases via calls from the public, general practitioners, and polyclinics. Operators at the SCDF Operations Centre check on the symptoms and travel history of suspect cases before paramedics take them to the hospital. Under Singapore's DORSCON Orange status, SCDF officers don full personal protective equipment when responding to all medical cases. This extensive process of contact tracing and frequent cross-agency cooperation have helped Singapore to quickly identify potential COVID-19 cases and limit the further spread of the disease.